This video has been developed by the Women's and Men's Health Physiotherapy team at Oxford University Hospitals. Please follow the exercises in this video as guided by your physiotherapist. Our contact details are provided at the end of the video should you have any questions regarding these exercises. This video includes a series of exercises designed to strengthen the deep abdominal muscles. But firstly, we're going to recap how we can effectively contract the deep abdominal muscles. Your starting position will be determined by the exercise that you're about to perform. It may involve you being on your back, on your side, or resting on your hands and knees. For the purpose of this recap, Natalie is going to stay on her back. Additionally, you may wish to place a towel underneath your head if you're lying on your back or lying on your sides. Now we're going to have a look at engaging those deep tummy muscles which sit just below the belly button. We're going to take a breath in through the nose, and on the breath out, we're going to draw those tummy muscles down towards the spine. And we're going to hold that contraction throughout all of our exercises. You may wish to practice this a few times before moving on to the exercises in this video. Whichever exercise you're performing, it is really important to continue breathing throughout. All exercises should be completed within comfort, so please stop if you encounter any discomfort. Your physiotherapist will be able to advise you on an appropriate number of repetitions and sets to complete, which suits your ability. Like in the level 1 video, we're starting with the hip twist. Starting on your back with both knees bent and nice and rested through the shoulders, the ribs and the pelvis. We're going to engage those deep tummy muscles, pulling them down towards the spine, keeping them engaged throughout our exercise. We're then going to focus on one leg, floating that leg up to 90 degrees. And then whilst keeping the tummy muscles engaged, we're going to float that leg out to the side as far as we can without the opposite hip lifting, and then slowly slide it back in. We tend to suggest doing up to 5 repetitions on one side before we rotate onto the other side. Last one. Good, we drop the foot back down, relax through the tummy, engage back up when we're ready, and then come over onto the other side. Still keeping an eye on the opposite hip, making sure it's not going to rotate over. Last one. Good, placing the foot back to the floor. Our second exercise is one leg stretch. So starting on our back, we're going to engage those deep tummy muscles and then lift one leg up to 90 degrees. We're then going to extend that leg out, drawing it back into 90 degrees and then placing the foot back onto the floor. You may wish to relax those tummy muscles, then re-engage and turn onto the other side, lifting up to 90 degrees, stretching out, back in, placing the foot onto the floor, relaxing the tummy muscles, re-engage and swapping over once more. 90 degrees, stretching out, drawing back in and down, relax the tummy muscles, draw them back in and again. 90 degrees, stretching out, back in and down. We're now moving on to try the scissors. Again, starting on our back, drawing those deep tummy muscles into contraction, and then we're slowly going to lift one leg up to 90 degrees. Pause, and then slowly drop the leg back down. Relaxing through the tummy muscles, then when you're ready, sinking them back down towards the spine and swapping over. 90 degrees at the leg, then slowly dropping down. We'll do one more on each side. Relax, re-engage, floating the leg up, slowly down. Last one, relax, re-engage and floating up to 90 once more. Our fourth exercise is a leg lift in 4-point kneeling. So starting on our hands and knees, first of all we're going to find the right position. We're looking for a flat back. And to do so, we're going to drop the tummy down towards the floor, arching the back, then floating our way all the way up to the ceiling, arching up, and then slowly resting in between those two extremes. We want to keep this all the way through. Next, we're going to draw up those deep tummy muscles towards the spine whilst maintaining that flat back position. Next, we're going to extend one leg out along the floor, then slowly slide it back in. Excellent. You might want to relax those tummy muscles, then draw them back up and swap sides. We don't want to be twisting as we transfer side to side. Relax those tummy muscles, drawing back up, and this time we're going to add a bit more, so we can slide out, and if you'd like to, we're going to lift the leg off the floor, keeping that flat back, drop it down, and slowly bring it back in. Relax through the tummy, draw it back up, and swap sides, sliding out with the addition of lifting the leg up if we're comfortable, lowering back down, sliding in, and making sure those tummy muscles relax. Let's now try arms and leg lifts together. So this next exercise is a progression of the one that we've just been through, and we're going to look at lifting the arm and the opposite leg at the same time. But first of all, let's find that key position. So we're going to lift up and slowly back down, then find the middle between those two positions and a lovely flat back. Lifting those tummy muscles, drawing them towards the spine, maintaining a lovely flat back throughout. And then we're going to lift opposite arm and leg out along the floor and continue up and slowly come back in. Releasing the tummy muscles, draw them back in and swap sides. Reaching out and back in. Relax the tummy, draw it back up, and again on the other side, making sure we don't dip in the middle. Relaxing the tummy, draw it back up, and changing sides once more. And now we're going to finish with squats. Starting and standing with your feet hip width apart and your arms resting by your sides. Gently engage those deep tummy muscles, pulling them in towards the spine, and slowly we're going to bend our knees, pushing our hips backwards and reaching back towards the chair. Slowly push yourself back up into standing. The most important thing here is making sure that your weight is equally distributed through both sides and you're keeping those tummy muscles engaged all the way through. You don't need to have a chair behind you, but it can be quite good to use as a reference point to make sure that you're completing the exercise correctly. If you encounter any issues or have any questions, please don't hesitate to contact the department and ask to speak to your physio.